Abdou Sebushishe with the International Medical Corps. He's currently helping with the mobilization of those critical medical teams in the DRC and surrounding communities. Dr. Sebushishe, thank you so much for joining us for an update.
Thanks for having me.
Doctor, the CDC counting this Ebola outbreak as the 17th in the DRC just in the last 5 decades. The last one, late last year, which according to the CDC was stopped within weeks. So why is that, from your point of view, why is containing this outbreak proving to be a greater challenge?
Well, the situation on the ground remains serious. This outbreak, as you mentioned, is the 17th in the DRC, but particularly this one is caused by a strain of the virus that does not have any approved vaccine or specific treatment. It is happening within the context of a humanitarian situation and other related access issues, which make it a little bit more complicated to handle than the outbreaks. Right now, International Medical Corps is expanding and operating Ebola treatment centers with sufficient isolation capacities, including the unit for suspected and confirmed cases, but also reinforcing infection and prevention control measures in health facilities to safely protect healthcare workers, patients, but also the wider community. At the same time, also delivering psychosocial support for patient families who lost their loved one, but also our own response team who are working under stress. We also provide us to them with enough knowledge and tools to be able to identify quickly and care for patients seeking services in treatment centers.
Doctor, we're so grateful that you're with us, not just because you're in the region, but you also grew up in the region. So these efforts are certainly personal to you. Grew up in the DRC. Speak to the challenges of getting teams, but also information to some of the remote areas that are, in many cases, either caught in conflicts or experiencing insecurities.
Yeah, you are right. For me, this is personal. I grew up in Goma and experienced at my early age one of the worst cholera outbreak in the region. But also, that memories keep coming back, especially when seeing the number of suspect cases that are being reported and seeking services. Our priority currently is working with affected community, ensure we have access to all the locations that are affected by this outbreak, provide necessary support in terms of contact tracing, facilitating the access to services, and ensure that the supplies that the healthcare workers needed to ensure their safety, but also safety of their patients, but also limit the transmission, get to the right place, especially those areas that are hard to reach. Our close collaboration with affected population allow us, but also in partnership with other humanitarian partners, allow us to even go beyond, even in hard to reach areas and areas that have access issues.
And Doctor, you mentioned right now what are the current expansion of efforts to try to contain this. So it certainly speaks to that sense of urgency right now on the ground, especially given what we heard recently from the WHO, that it was likely that this was spreading months before it was first detected. However, with the potential of this being much larger than what the numbers are showing, as a doctor in the region, how worried are you that this could worsen and potentially even meet the criteria eventually of a pandemic emergency? We should remind viewers that so far, the WHO still considers this a public health emergency of international concern. But are you worried that this is likely to get worse?
Yes, but there are a lot of effort from different partners and different communities with focus on saving lives, limit transmission, but also working closely with the community to understand the outbreak and how to prevent it escalation and transmission beyond its current hotspots. So there is a need of more mobilization in terms of trained personnel, protective equipment, stocks, and logistics to maintain the momentum and limit the spread of this disease beyond the current hotspot. I think that should be the priority of anyone. And at the International Medical Corps, we ensure that we coordinate with our different partners, essentially with communities that are affected, so that they understand that they are key in stopping the spread of this outbreak and limited transmission, whether in community or in health facility, so that it doesn't cross the borders or go beyond its current hotspot. However, they still need a lot of effort, and we are hoping the engagement that putting in place this will be done very quickly within the current hotspot.
Yeah, you're highlighting there the importance of protecting those who are currently in the front lines of this crucial battle against this this threat, including members of your organization that are there trying to help with those efforts. Dr. Abdou Sebushishe, your time is certainly precious during these moments, so thank you so much for sharing some of it with us to keep us up to speed. Our best to you.